Coming up on this edition of the Paw Report, we're talking about aging pets and some of the syndromes that might happen to them as they get older. I've got my friend Mercy here, and she's going to help us out on this episode, so stay tuned. Dr. Sally Foote will be in the studio to talk all about what you need to know about your aging pet. That's coming up next on the Paw Report. Production for the Paw Report is made possible by
Inyart Tire and Auto Center in Charleston and Mattoon. Inyart offers complete auto repair. Inyart Tire and Auto Center cares about our community and thanks you for being a responsible pet owner. More information at inyart.com.
Hello and welcome to this episode of the Paw Report. I'm your host, Kate Pleasant, and I'm joined today by Sally Foote. Dr. Sally Foote, thanks for coming today. You're from the Okaw Veterinary Clinic in Tuscola. And we're talking about a problem that happens sometimes with older pets, right? And there's a name for this syndrome.
Right. The term is cognitive dysfunction syndrome. Sounds pretty big.
It does.
What kind of a common way to think about it would be senility, or an older pet going senile. And so it's well recognized now in the dog, and we are recognizing a similar syndrome, or the same syndrome basically, in the cat. And this is Mercy.
I was going to say, speaking of cats, that's Mercy. We didn't introduce Mercy.
Yes, this is Mercy. She is our other office pet, and she lives with Ranger, and Mercy is 17. And so I thought I'd bring Mercy today because she is representing our
the older folks.
The older folks, the old pets, and she really is doing very well with her aging and that. And you know, sometimes at the office she may be like, you know, she doesn't miss a litter box. That's one of the signs of the senility. But sometimes she may kind of walk out in the middle of the waiting room and things are quiet, like, why am I here? And then she may sort of get it. And these are some of the symptoms or signs we may see in dogs and cats with this CDS, cognitive dysfunction syndrome.
Okay, that's good. So what should we be, looking for at home to start noticing maybe some signs of this?
Well, there's an acronym, like these four initials are the different, like 4 different areas where we will see effect or problems when they're having cognitive dysfunction syndrome, and it's DISH. And so we can have D for disorientation. And that is, like I said, the dog is like, he was sleeping and he gets up and he's now walking into the kitchen and he stops, like, why was I come in here for? And,
people do
and he's near his water or food dish. Yeah, kind of like people. Anyway, near the food and water dish as if he was meaning to go get a drink of water, but it's kind of, he stops and like, I'm not sure where I am or what I'm doing. Or the dog like always goes to the back door to go out to the bathroom, but instead of going to the side where the doorknob is, where he would actually go, he's standing by the hinge side. And he may be standing there and looking at the hinge, or like with his head toward the corner of the wall. He's on the wrong side of the door, but he can't realize he's on the wrong side of the door. So that's like orientation. And so I is interaction. And this is like, how much are they seeking like attention and petting? Are they coming to greet you when you come home from work at night? Now this is where, especially with interaction, we really have to work out, are we having any hearing problem or a vision problem that they can't tell you're home until you actually walk up to them. So that's where history and observing the pet. S is sleep pattern. So we may find that the dog or the cat especially, this is where we get the complaints on the cats, are getting up not just getting up in the middle of the night to say to go to the bathroom, but they're up and they're up. And they're up and they're walking around, and they're like, maybe now he's knocking his ball around like he wants to play, and it's like 3 o'clock in the morning, what are you doing? Or the cat is in the bottom, went from sleeping in bed with you downstairs and is now sitting at the bottom of the stairs.
Oh, okay.
Like,
so that's
wake me up,
that's not
time to
average
go.
cat behavior, huh?
No, not necessarily. Now we can see that in cats if their thyroid level is too high, and that's a common aging problem in the cat. But still, we want to know, basically, is your dog or cat driving you crazy because they're getting you up in the middle of the night, and what are they needing to do? And H is for house training. Okay. And so we may see problems where, the dog now is soiling in the house. Again, that is something, and the cat too. The cat may be missing the litter box. Maybe they're going near the litter box, but not in the litter box. And again, that's one thing we really have to decipher. Do we have a urinary problem that it's, that's why we are having change in urination, or in anything with their stools, like maybe they have to go more frequently, versus it is kind of a complex set of steps for a dog to know, I need to come to my owner and stare at you or bark at you, and then you get up and you let me out the door and I go outside and I go to this spot and I go to the bathroom.
Right.
You know, that's a chain of steps, and with the dysfunction syndrome, and maybe the dog gets or figures out, oh, I get up and I go to the door and now what do? And then he goes to the bathroom because he's not remembering, say, to go get you and that.
Okay. So do we know what causes this?
Boy, good question. Actually, what we do know is what's happening in the brain, and actually what's happening in the dog is a model for what happens with people with Alzheimer's, and that there's damage to the cells in the brain, and these cells in the brain are dying off. And they're dying off more in this frontal area of the brain, which is very much of learning and memory. And so what's called oxidative stress, which basically means chronic inflammation in the body, sends off, I'll call it junk. The term is free radicals, but anyway, junk in the body, and that junk actually increases how the brain cells age and die off. And this is also found to be true, or in some types of dementia in people, also found to be true. So I don't want to call it treatment, it's more management of it, or ways to slow the progression or help to reduce some of the signs, is giving the pets, there are some medications that help to increase what are called neurotransmitters, the brain chemicals that help for learning and memory of the cells that are still there, because we can't necessarily replace the brain cells that have died off. The second thing is there's a lot of there actually are diets to help with this, and nutritional supplements.
Oh, that's interesting.
Right, that help to boost up or fortify the brain cells that are working, to decrease, to slow down some of the free radicals that are increasing brain, cell death, and help improve their ability to manage, I don't think the pets really care whether or not they remember your name.
Right.
That affects us with people, of course, with senility. But at least if we can help our cat remember where the litter box is going to go go there properly, or the dog to make it outside, or not wake you up at 3 o'clock in the morning, then your pet's happier because they're sleeping through the night, and you're happier too with your pet because you're not being as affected, with problems in the home.
Okay. Is there a range of ages that this is happening for dogs and cats?
Yeah, that's a good question, because in the dog, we do see it. It will primarily, as they get what we'll say is geriatric, really very old. And as pets are living longer now, that's really great. That's how we started to see it, because now in the larger breed dogs will show it at a relatively younger age as compared to like our toy breeds or specific breeds like the poodle. The poodle has probably the longest longevity of all dogs, purebred dogs.
I didn't know that.
Yeah, I mean, you see a lot of poodles make it to 20.
Old poodles.
18 to 20, right? But you don't see Great Danes do that.
Right.
So in like our giant and large breed dogs, because at age, say in a Labrador, at age like 14 or 15, compared to a human, they might be like somebody in their 90s. That may be where you will actually now start to recognize he has some of these symptoms. Sometimes it may start in these bigger dogs as young as, say, age 12, some things. And like I said, there's certainly steps that can be done to help them at that young of age. So you don't want to put off like, he's just old.
Right.
And in the toy breeds, it may not be till they're like 16 or 17 before you may see some of these effects. Now in kitties, like Mercy here, this is definitely a problem more when they are like 17, 18 years of age, like really more geriatric. More of what we see, I think she wants to explore.
She can go for a walk.
More of what we see in the cat is when they are closer to being like 18, 19, 20 years old, before we'll get the stories or the concerns from the owner that my cat is sitting at 4 o'clock in the morning yowling and I don't know if she's hungry, I can't tell if she's in pain, what is my cat doing,
Yeah.
So
is there a trigger or something for this, or is it just with the aging process, kind of like you mentioned?
Well, sort of a trigger maybe if they are having any trouble with, say, arthritis or chronic pain, because pain or arthritis, that's an inflammatory problem. That really showers the body with a lot of these free radical chemicals. So when we see, or if there's been like an acute illness, say we've had an infection in the kidney, or an infection in the liver, because that organ is really responsible for taking care of a lot of your body needs and removing toxins from your body.
Okay.
And so anything, you know, that's kind of toxic or harmful junk in your body,
Right.
I'll just use that word again, that is what aggravates, you know, the dysfunction syndrome.
Okay. Are there things that we can do to help our older pets, you know, that may be experiencing this?
Yes. Like I said, first of all, take your pet to the veterinarian regularly for annual wellness exams. And if there is a problem, let's just say like Mercy here, she came to us because she was hit by a car in front of the Tuscola library and had a fractured hip. Well, I fixed her hip and we ended up keeping her. So she's lived with, you know, arthritis in her hip and it's managed. She's on a joint supplement. She gets some moderate pain relief. Actually, right now she's getting some acupuncture and chiropractic. So she, as you can see, she likes the petting. She can move around. She looks pretty good. She also is mildly hyperthyroid.
Okay.
And for her, she's managing on the diet for cats with hyperthyroidism because she's not the easiest cat to give medication to. So we keep her up on these things. And it's not difficult in a lot of drug or medication, but that's important. And we don't see our cats often enough for wellness exams. And sometimes people feel like, well, they're just old. So anyway, take your pet.
You hear that a lot from veterinarians, you know, people will come in and tell them, well, I just thought they were old. And there's a lot of things before that that you might have been able to prevent if you would just take them in regularly.
Right. So kind of like your body, when we have the body health really good, we start with that. So then let's say we do that, but the dog is still pacing at night.
Okay.
Then the things that can help is some of the supplements can help. You know, to help them improve on that. But the second thing, as far as what can, before they get that bad, what can we do to prevent it? Food puzzles are great. I love these, even for old dogs. Now we use these a lot for puppies, but how these
puppies use those a lot, right?
Right. So how these work is that we will take, like this unscrews, and I call this purple flying saucer. And Mercy, I'm going to use some of your treats, but we just put that right in here, and it screws shut. And when you put this on the ground, I'll just put it on the tabletop here. It rolls around. Now this is Mercy. You want to come here at all, honey? Whoops.
Nice catch.
Yeah. Okay, so on the kitty one, it's a similar idea. I don't think this one unscrews.
So this would be like your dog version.
Right, that's the dog version. This is a cat version.
Little kitty
We
version.
load it inside with her treats
okay.
or food. Let me see if she will demonstrate for us. With live camera,
try.
folks. Here.
You want to come over and try
Sorry,
this?
honey. Oh. She says, I don't know.
Go.
Anyway, the cat will knock this around and they'll get their treats fall out, as you see. The other thing can be, this is, play is really important for both the dog and cat. So that's the other thing is play. This is a little catnip mouse, which has a little opening. We could put the fresh catnip in. And then we can toss this for Mercy so she can run and play and bat it around. And for our dogs, walks. Take your dog for a walk. If they're older and it's like, well, he doesn't like to walk more than 5 minutes, fine. 5 minutes is fine. And change the direction. Change where you go. That
maybe
really,
not the same route every time.
Exactly. Don't go the same route every time. Changing that direction, changing that route, it's like opening a whole new book to them. You know, they smell other smells, they see other sights, and this opens up their brain pathways. Exactly. It's making it work like, oh, I haven't smelled this in a while. I wonder what that is. But it does really help them. And that just really, and the walking too for the dogs, gets a circulation through their joints and in their liver and in their heart and their brain, and really helps them.
Okay. What are some other things, you know, that we should be doing with our aging pets besides, you know, the wellness checks and the walks? Are there other things we can help them do to transition from, you know, being a younger pet to an older pet? You
know, I think one of the best things is to match what they're eating according to their life stage. So what that means is a puppy or a kitten eats puppy or kitten food. The adult pet eats the adult type food up to about age 7 or 8. Believe it or not, age 7 or 8 is middle-aged. You know, for a dog, for a cat, might be up to about age 9. And then when they get to that age, switch to a senior food. What's been put into the diets, even the over-the-counter, you know, like Purina, O&E or whatever, they have been fortified with some of these antioxidants. And these antioxidants are part of what's cleaning up the junk to help slow down things like brain aging. And they have supplemented these senior diets accordingly for dog or cat, what they need, say with extra B vitamin or extra omega-3 fatty acid. Now then, if your pet has more effect, you know, or has a health condition, always consult with your veterinarian on what is the best diet for that pet to eat. Please don't switch around with the raw food diets or this or that, because you can cause more harm than good. But sometimes people don't realize that there really is a nutritional and benefit to their health by going to like the senior diet at the age, you know. And then when they're geriatric, there are even some, I'll call them super senior diets, you know, for them as they really get older. So that would be one thing. The second thing is accommodate them, you know, like, hi, Miss Mercy. So Mercy, yeah, she's older and she's got arthritis in her left hip. And so most litter boxes are this tall.
Sure.
And that was fine for her until she was about 12. And we noticed, while she still made it in the box, if you watched her, it was work.
Yeah.
And that would be kind of like asking a grandmother at 85 to please
get up
climb
on a really high toilet.
Yes, exactly.
Or get into a step over the bathtub, you know,
step
to
over
get
the
into
bathtub and
bath.
go over this and that to get to the toilet.
Right.
So we actually made a litter box for her, and if you want to go to the website, you could see it. But we took a Rubbermaid keeper, you know, one of those big tubs, and cut out a doorway so that the lip is only about an inch and a half tall. So there are enough litters in there so she takes care of her needs, but she can basically almost walk straight in, and it's covered like she likes it, so she can take care of her business, but that accommodates her, and it's real easy for her to use that litter box so she can keep up with eliminating like she needs to without a struggle.
Right.
She also has, I think I brought her little green fuzzy blanket here, but we have that in a really soft bed for her. And that just helps her to feel more comfortable. So these little accommodations, getting steps for your dog to help get up on the couch. If he likes to lay on the couch and it's available in your home, fine. Little steps to get up on the couch. Sometimes ramps for the older dogs because it's easier than trying to step up and down the steps or get in and out of the car. Those are ways to help accommodate for the dog too.
Okay. Are there supplements and things we should be giving aging pets? You know, I know you see a lot of things for joints and stuff like that are over the counter. What are your thoughts on those?
Definitely, according to what your pet needs, they should be getting some of the supplements. Now, here's the thing with supplements. The vitamin supplement industry is not as well regulated to be sure what's in that pill is really in that pill as compared to medications. Now, that being said, there are some supplement companies that themselves, you know, internally do really do their quality control to make sure what's in there is really in there. So many pets are really benefited, both dog and cat, by giving them a joint supplement. Maybe starting like in a cat by age 15 and a dog certainly by age 11 or 12.
Okay.
And how much they should take depends a little bit on do they have arthritis or not, you know, and how old they are. So again, check with your veterinarian. And secondly, there are some of the ones over the counter that are very good. And I'm not gonna name brand names because I know we can't here on PBS, but again, your veterinarian can tell you what are the good brand names over the counter that actually have in there what they need to have in there. And lastly too, we have a problem in this country with some of the products coming in from other countries that have been contaminated. You know, we have seen mercury poisoning and some people giving supplements to pets that were less expensive because they came from overseas where they don't have the regulation to keep, you know, the base products free of some of the heavy metals. So always just double check with your veterinarian. You could say, hi, I found this, you know, at the pet store. Is it okay? Or I saw it online, but before I give it, double check with your vet and your vet staff.
Okay. And is there, you know, if someone comes to you and says, you know, my pet's having problems, what's the exam like to determine if it's just, you know, like you said, a health problem, like urinary problem or something like that, or if it's this cognitive dysfunction syndrome?
Well, on every pet, dog or cat that comes in, the veterinarian should be checking the weight, veterinarian or between veterinarian and technical staff, you know, checking the weight of the pet, what we call a body condition score. And so what that is as I feel over Mercy's body and I look at her, you know, can I see the shape of her rib cage coming down over her back, how thick and how well muscled is her body, as opposed to maybe is she feeling bony over her spine. While her number may not have changed in her weight, but if her condition is changing, she's losing muscle mass, that's going to tell me something. Maybe she's losing protein through her urine or protein through her intestinal tract. And from that, then I may suggest we're going to check a urine sample, we're going to check, you know, a stool sample. So, you know, listening to heart and lungs, et cetera. A lot of times on the older pets, we'll also add in checking blood pressure, checking the actual eyes of the pet, and maybe actually have them down and do more of walking around and checking their reflexes.
Okay, so you're watching them.
So you're also incorporating a little more of a neurological exam, a little more of an eye exam, and a little bit more of, you know, kind of a total body feel over. I don't know how else to describe it.
Yeah, just touching, feeling, physically putting your hands on
and that
the
goes
pet.
for both dogs and cats.
Okay,
you know.
okay. And is there, you know, a difference between the dogs and cats as they age as far as the things you'll start noticing?
I say yes. In our dogs, what we tend to see more as they age is more of the orthopedic problems, especially in our dogs that are over 50 pounds. The second things I would say that dog aging health problems that lead things are heart disease. We tend to see more problems with congestive heart failure, that kind of thing. Lastly, too, if they've been overweight all their life, we'll just see a lot more problems with the pancreas or liver. In cats, primarily an aging problems in the cats are either because of the kidney, their kidneys are not functioning well enough, their kidneys are kind of their target organ, or overactive thyroid disease. And from that, then we can see other like intestinal problems. But I say kidney, thyroid in the cat are your biggest things you're thinking about, and then, you know, orthopedic, and then heart in the dog. And they won't show pain the same way. You know,
that was going to be my next question, because, you know, I'm sure some of that's painful as they age. So how do we notice, you know, maybe that there is pain there?
Okay. Pets will not cry in pain. They're not going to limp. They're not going to hold up, you know, a leg until they're on a level 9 or 10 on a scale of 1 to 10. And think back to these guys, you guys were in the wild a lot longer than we were. And the reason is that if Mercy was limping and she's seen out by the coyotes as, ooh, lunch, you're an easy kill. So she is not going to limp. She's not going to show it until it's really excruciating and she can't function. But when she's at, say, like a level 5 or a little uncomfortable, what is she going to do? She is going to hide more. She's going to use her body less. She may avoid jumping up on things. She may be just a little slower. She's got to really think about, and that's the thing I'd say is called when the dog sits at the bottom of the stairs and goes, I think I want to get up there. Okay, I'll do it. So now
I had an older pet that did that all the time. You just see her sitting at the bottom going, oh man.
Right, exactly. That's that kind of level 4, level 5. I'm hurting, but it's not excruciating. I can get up those stairs. I'm going to do it. I can eat. I can go out. I can go to the bathroom. But when you then do get them on some pain relief or these supplements, a lot of times clients will be like, wow.
Whole different animal.
Different animal. He's like 3 years younger. He's doing stuff he hasn't done before. I forgot that he wasn't playing with his ball. I forgot he wants to go on a walk now. Oh my goodness, I didn't realize how much he wasn't doing. And that was, then they feel bad sometimes, like I missed it. And I tell them, hey, you don't think like a dog. You don't think like a cat.
Well, you're with them every day. And so, you know, someone that maybe only visits every 6 months would notice maybe this drastic difference in your pet. But when you're with one of your animals every single day, it might take you a little longer to catch on.
The other thing I would say too is sometimes in older pets, both dogs and cats, you may see an increase in anxiety or an increase in aggression. And the aggression is because they're guarding their body. If you now reached, like if Mercy was feeling pretty sore about her back end and somebody pets her and they get over here toward her rump and all of a sudden she flicks around like she wants to bite them, it's not necessarily, oh, she's just a cat. It may be, oh, she's got arthritis. Is her hip hurting today? It's raining today. You know, maybe she needs a little more of her meds, or we'll just avoid touching her. That's why she's that way. Now, we know this better because she lives with us. But if she was a pet at someone's home, sometimes people, she's just old. She's just crabby. Well, she's not just crabby. She's crabby because she's hurting. And that's her way of telling you.
Okay, so you should maybe consider increasing wellness checks as they get older.
Definitely.
That would be the first step. Okay. And any other recommendations? We have about a minute left before we go.
I really think the most important thing is to know your pet and to get other input from other family members. Yeah, Mercy, know you. In other words, you really know how they eat. Make sure you're feeding them independently so you can tell how much is this pet eating. You really know how their elimination, you know, going to the bathroom habits are. Not just like send them out in the yard and you don't see do they go or not. So really check that out. You really know how are they greeting you or other family members. You really know what makes them happy. Are they playing these? Are they still playing with their toys or not? You know their kind of sleep habits and patterns, because when there's change in that, there's a reason for it. And it's not always just, oh, they're getting old. It's because while aging may be bringing on some of these things, they're affected, and we can still give them some help because that's quality of life.
So you can make them more comfortable.
Absolutely.
So pay attention.
Pay attention to your pet.
All right. Well, Dr. Sally Foote from Okaw Veterinary Clinic in Tuscola, thanks for coming in.
Well, thank you.
And talking about our older pets. I'm sure that maybe we can hopefully get them all some help out there. So, and thanks for watching the Paw Report. We'll see you next time.
If you are a veterinarian, trainer, groomer, specialist, rescue organization, or shelter that would like to partner with the Paw Report by providing expert guests for the show, please contact us by emailing weiu@weiu.net or call 217-581-5956. If you have a topic you'd like to see on the show or questions for our experts, contact us with those too.
Did you know full episodes of the Paw Report are on YouTube? They can be accessed at youtube.com/WEIUTV. Then just go to the Paw Report playlist and select the episode you want to see. More information about the show is also available 24/7 on our website at WEIU.net under the Television tab. Production for the Paw Report is made possible by
Inyart Tire and Auto Center in Charleston and Mattoon. Inyart offers complete auto repair. Inyart Tire and Auto Center cares about our community and thanks you for being a responsible pet owner. More information at inyart.com.